We now move to another popular instructor at IUU, Dr. Hussein Rassool. Many of you must have heard Dr. Rassool yesterday when he delivered a talk on mental health and illnesses. Alhamdulillah, he's back with us today to speak about a very specific issue, which is post-traumatic stress disorder. A traumatic event in our life can leave a scar forever on us, but in some cases, it goes a step further and culminates into post-traumatic stress disorder. Perhaps dealing with the trauma in our life wasn't that easy for us, hence giving way to a mental disorder itself. The question is, how can you deal with this? What can you do to get peace and solace back in your life? These are important questions that Dr. Rassool will help us find answers to, inshallah. A little background on Dr. Rassool first. Dr. Rassool has a PhD in psychology and education from the University of London, an MSc in health education, and a BA in psychology. He is currently working as an academic advisor, lecturer in psychology, independent consultant in addiction and mental health, and clinical consultant of Sakina Counseling Institute and Research. Dr. Rassool is the author of 8 books and has published over 100 papers and reviews. Some of his published books are Cultural Competence in Caring for Muslim Patients, Addictive Behaviors, Theory and Clinical Practice, Alcohol and Drug Misuse and Dual Diagnosis, Islamic Counseling, and Introduction to the Theory and Practice. His forthcoming publications include Jinn Possession, Evil Eye, and Mental Health, Health Psychology from an Islamic Perspective based on the Quran and Sunnah, Addictive Behaviors, the Disease and its Cure, an Islamic Perspective. Of course, Dr. Rassool is also the head of the Department of Psychology at Islamic Online University. Let us not wait any further and turn our attention to Dr. Rassool. Over to you, Sheikh.
Jazakallah khair. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن استنى بسنة يوم الدين قال رب اشرح لي صدري ويسر لي أمري السلام عليكم ورحمة الله وبركاته. Just before I start, just to mention a couple of things which I think would help the audience. One thing that keep cropping in all the chat box since yesterday is to do with jinn possession and mental health. In fact, the last year conference, there's an hour session on it. You can go back to YouTube and watch it. And inshallah, maybe if you have enough popular demand, maybe inshallah, we may be able to do a conference just on this. The second thing is that this particular conference is going to be on YouTube, but not today, but once it's ready, it'll be on YouTube, be able to watch it. On top of that, it's going to be turned into a diploma. So don't worry, nobody's going to miss anything. You'll be able to watch it. You're going to be able to get some sort of certificate with it. Of course, you have to do the assignment attached to it to be able to get the diploma. So I hope I've clarified this for people, because it's that sort of questions keep cropping up all the time in the chat box about whether you'll be able to watch it sometimes. Inshallah, have patience, have sabr. You're going to watch it when they're going to put it on YouTube, and you should be able to watch it. Okay, I'll just move on to my talk today. The first slide, please. I thought I put some learning outcome, because I think at least we know where we're going. That's what I'm going to try to do, to explain the term PTSD, which means post-traumatic stress disorder, identify some of the potential causes of it, identify what are the risks, what the risks we serve, what are the religions, the resilience in the sense of, some people have the same trial and tribulation and get affected by it, others, get on with it and more or less cope with life. Describe some of the symptoms, look at the consequences, and also have a brief outline of treatment for PTSD. So it was brought to our attention, this particular syndrome, in a way, disease, or if you're a disorder, for what you call it, it was brought attention in relation to people going to war. Basically, historically, it was cell shock. But nowadays, it applied to a variety of trauma or traumatic incidents: rape, torture, mugging, being kidnapped, held captive, child abuse, sexual abuse, car accidents, plane crashes, bombing, natural disasters such as floods, earthquakes. And it may develop after a person exposed to one or more of those traumatic events. Okay? So let's say that anyone can get PTSD at any stage or at any age as well. This includes people, again, fighting wars, but also survivors of physical and sexual assault, abuse, accident, and so forth. But not everyone with post-traumatic stress disorder has been through a dangerous event. Because some people get PTSD of their friend or family member experience danger or harm, while others do not. In fact, nowadays, when we think about our brothers and sisters, from Sham, from Iraq, and Syria, going through, the journey, or the migrants coming to Europe. In fact, a lot of these people nowadays are suffering from this. Not only adults, but also children. Let's make dua for them, because a lot of these people are suffering from post-traumatic stress disorder, as well as depression and all the consequences of going through war, going through trauma. This is trauma. War is trauma, and it affects psychologically and physically, socially, and all sorts of other aspects of one's life. Let's look at what is, the next slide, please. What is post-traumatic stress disorder? It's a disorder. It's an anxiety disorder, which means that there must be an element of anxiety in it, that you develop of experience. Either you experience something or you witness something. Yeah. And that involves certain intense fear, helplessness, sometimes panic or horror. So, in other words, a disorder that develops in some people who have experienced a shocking, scary, or dangerous event, like I said before, like a war. But it's natural to feel afraid during and after a traumatic situation. You have fears, because fears triggers many split-second changes in the body. And this helps us to defend against danger or avoid it. Most of us who do psychology would know about the fight or flight response, because either you fight the situation or run away from it. So the fight and flight response, the typical reaction when they are out of the danger, because one of the symptoms is that they tend to relieve the experience. Here we're talking about causes. In fact, the causes are unknown. It could be a relationship between genes, psychosocial factors, all these are involved. But we know that there's some evidence that susceptibility to PTSD is hereditary, is genetic. Approximately about 30% of the variants, genetic variants in PTSD is caused from genes alone. Of course, you have trauma, violence, war, attack, sexual abuse, physical abuse, domestic violence also, military experience we talk about, foster care, and drug misuse, alcohol, and drug abuse. All these occur sometimes with post-traumatic stress disorder. Now, these are research that's been done looking at factors. What are those factors, psychosocial factors, that lead to you being vulnerable? Yeah? The first one is what we call biological diathesis. It's a big word. What it means is that when we explore how biology or biological or genetic traits interact with environmental influence. For example, your genetic trait will interact with stresses to produce disorders such as depression, anxiety, or schizophrenia. In this case, there's an interaction between the genes and the environment. Early childhood developmental experience. to do with attachment, to do with deprivation, maternal deprivation, severity of trauma, how long, how severe the trauma is, interpersonal trauma, which is between people, genetic factors, or women develop PTSD about twice the rate as men. And also, if you had prior history of it, or you had previously had some trauma, could be physical abuse, sexual abuse, or car accident, or whatever trauma you had. Next slide, please. These are some other factors leading to vulnerability. For example, if you had a history, what we mean by premorbid psychiatry is you had a history of psychiatric disorders. You have your personalities, to do with personality there, you have a history of this particular stress factor and or psychiatric history, and that can may lead to PTSD. Fewer social support, limited interpersonal coping skills. That your coping skills, you may have coping skills, but they may be negative coping skills. The intensity of the trauma, personal perception, how you see the events, because sometimes it's not the event that's frightening, it's sometimes the way we see it or interpret it, and also finally everything. All these are from research. The next slide, again, some more factors which has been found. Female versus male, older age. We talked already about biological factors. Psychological factors, we already talked about certain personality traits. People who are neurotic, people who are introverted, not extrovert. Or having post-trauma social resource. Maybe there's no social support. There's a lack of social support. Economic issues, social issues, marital issues, family issues, disruption in the family because of war, because of trauma, because of it affecting all your daily life. Relocation, the death of very close partner or a partner or family member, or second loss problem. All these may lead you, doesn't cause PTSD, but may influence, may trigger you having PTSD. The next slide, please. Now, what happened in the brain when we have PTSD? In fact, to put it simply, we have three areas of the brain in which function may be altered in PTSD. And this has been identified. The prefrontal cortex, you can see on the slide there, the amygdala and the hippocampus. Now, PTSD symptoms may result when a traumatic event causes an overactive adrenaline response, which create a deep neurological pattern in the brain. Now, this pattern can persist long after the event, and that triggers the fear, making an individual hyper responsive to fearful situation. So any fearful situation in the future, they're going to respond. So during a traumatic experience, the high-level stress hormone suppress this activity of the brain, especially the hypothalamus. That may be a factor towards the development of PTSD. This is a simpler way of explaining it. We don't really need to go further into it. Next slide, please. Now, if we look at research, meta-analysis is a type of research. Yeah, so those who learn research methodology would learn about one of the methods is meta-analysis. Now, what they did is these are research that has been studied since 1980s. Basically, the researcher, Chris Brewin et al., they look at 77 original research on post-traumatic stress disorder. And this meta-analysis were conducted on 14 separate risk factors for post-traumatic stress disorder. and the moderating effect of various sample and study characteristics. This includes civil and military exam. So in fact, that's what they found. These are the risk factors, which mean it's to do with your gender, age, socioeconomic status, education, intelligence, race. All these are factors that can trigger or maybe a risk factors in the development of PTSD. Sometimes it's not a single factor. Most of these are multifactorial causation. After risk factors, now next slide. We know that some people, for example, sorry, there's some technical problem there. I can carry on speaking because when the slide come on. Here, the slide you're going to see, inshallah, is to do with what we call the DSM. I talked about it yesterday, the Diagnosis Statistical Manual 5. This is where they have put the disorder. And again, it's, for example, exposure to trauma. And they put all the symptoms and so on. So anyway, it's like a manual to try to diagnose, post-traumatic stress disorder. Right. Okay, we got our slide back. Can we have the next slide, please? Thank you. Jazakallah khair. Right. That's what we're talking about. I would no more worry about the +1 and +2, whatever it is. These are the manuals I talked about yesterday, the DSM-5, and they have it's a diagnosis, and these are the sort of symptoms, for diagnosis of post-traumatic stress disorder. Let's move on to the next slide, please. Okay, just move on. Right. Again, these are some of the other risk factors. Getting hurt or living dangerous events, or witnessing somebody getting hurt or seeing a dead body, for example, or during childhood you have some sort of traumatic experience, very painful experience, feeling of horror, helplessness, or extreme fear, or have little or no social support. But social support come out in everything, on all the variables, because I said yesterday, no social support, we have negative health outcome. Better social support, you have positive health outcome, which means that with social support, you do get better in almost everything. Dealing with extra stress of that event, such as loss of a loved one, pain and injury, because once somebody go through those experiences, the post-traumatic, sometimes they become a very different person, and sometimes their marriage breaks up. Sometimes, because they, so their life changes, they lose their job, and this have total effect on themselves, their family, and all the significant others. Or another risk factor, which I already mentioned before in the research, is having a history of either mental illness or addiction. Next slide, please. Here we're talking about resilience factors. We know that some people go through some bad experience and come out of it with little help, little social support. Others have problems. Now, these people who can come out of it, they have some sort of what we call resilience factors. Yeah. So these are the factors that protect us against post-traumatic stress or aid recovery. For example, again, seeking out social support or support from other people, such as friends or family. Finding a support group after traumatic event. Learning to feel good about one action in the face of danger. Having a positive coping strategy. Or being able to act and respond effectively despite feeling fear. So researchers are studying the importance of these and other risk factors, or resilience factors, including genetics and neurobiology. And so with more research, we're getting more knowledge, understanding about whether we can predict who is likely to develop PTSD, and also if we know that, then we can prevent it. These are the signs and symptoms. It really begins very early, within 3 months of the incidents. But sometimes it could be a year or years afterwards. It could be 2 years after the initial traumatic events. Symptoms must be at least more than a month and be severe enough to interfere with relationship or work to be diagnosed or to be considered as having PTSD. And also the course of the illness varies. Some people recover within 6 months, while others have symptoms that last much longer. So in some people, the condition becomes chronic. But not every traumatized person develop an ongoing chronic or even short-term PTSD. Because not everyone with PTSD has been through a dangerous event. Some experience, like the sudden, unexpected death of a loved one. And this can also cause PTSD. So some symptoms usually begin early, within 3 months of the traumatic incident, but sometimes they begin, as I say, years afterwards. So this is graphic representation of the chart showing some of the most common signs of and symptoms exhibited by those suffering from post-traumatic stress disorder. And each individual have a unique symptoms based on their pre-existing mental condition or mental predisposition, severity of the battle, and other genetic factors. Remember that PTSD is not only experienced by those who have been in war. We know that. We know that from research, but also anyone who has experienced a traumatic event or a series of traumatic events. Now, there are 3 categories of experience. So if these are present, then you know somebody's good. One, they tend to re-experience the events. Secondly, there's avoidance and emotional numbings, which mean that they totally, what we call in psychology, lack of affect. They have totally devoid of emotion. And also they have problems with their sleep pattern. They have changes in their sleep pattern. And they have very disturbed sleep pattern. Let's look at something a bit more elaborate. So when people are really experience the event, they have bad dreams. They have nightmare. Next slide, please. Sorry. They have flashbacks. And these flashbacks, which mean that you go back to things that happened before. And this can be caused by sense of smell, or you see an image. There are cues in the environment which trigger off that feeling, and that feeling bring back the nightmare, the dreams, a horrible experience. So you re-experience a traumatic event in the mind, and that causes, as we know, distress. Sometimes people have excessive sweating, perspiration. They get panic attack, or sometimes they think that they have increased heart rate, the blood pressure goes up, and they think sometimes that they're having panic attack, they think they're going to have a heart attack. So flashback is reliving the trauma over and over in your mind, including sometimes physical symptoms like, I say, sweating and racing hearts. So re-experience symptoms can cause many problems, because if you have this, it's going to affect your routine. Because these symptoms can start from the person's own thought and feeling, words, objects, or situations that are reminders of the event can also trigger re-experiencing, avoidance, and emotional. This includes staying away from places, events, objects that remind us of traumatic experience. Withdraw from friends and family. We're avoiding thought or feeling relating to the traumatic. It's a bit like denial now. Nothing has happened before. We try to avoid it as much as we can. Things that remind a person of traumatic event can trigger what we call avoidance symptoms, which mean that as if nothing is happening, or nothing happened, it happened to me, total denial. And these symptoms, because the person to change his or her personal routine. For example, after a bad car accident, a person who usually drives may avoid driving or riding in a car. This is one example. So they have guilt, dissociative state, and depression. When we come to dissociative states, in rare cases, the person act and react as if they're living through experience again. This can last from anywhere from 5 minutes to several days. So they have persistent symptoms of increased arousal. They have difficulty in sleeping, or difficulty falling asleep, or staying asleep, become irritable, outbursts of anger, because irritability can progress to rage, and this can lead to aggression and potential violence. Difficulty in concentrating, hypervigilance. In fact, sometimes this imitate or resemble paranoia, exaggerated startle response. At least two of the symptoms, you should at least have two of the symptoms to be diagnosed with PTSD. So there's problem with sleeping, aggression, and also problem with concentration. And the person always feels tense and what we call is always on edge. Next one is, do children react differently than adults? Yes, they do, because they can have extreme reactions. The symptom may not be the same as adults. And in school children, these symptoms can include enuresis, bedwetting, wetting the bed, yeah, forgetting how to be able to, unable to walk or talk, acting out scary events during playtime or through their drawings, being usually clingy to their parents. So children at this age might also show signs of PTSD in their play. They might keep repeating a part of the trauma. These games do not make their worry and distress go away. For example, a child might always want to play shooting games if they see a school shooting. Children may also fit parts of the trauma into their daily lives. So I know this is an extreme example, but for example, a child might carry a gun to school after seeing a school shooting. Don't do that at all. In the teens, you also have PTSD. Next slide, please. So some post-traumatic stress disorder start during adolescent period, and it look more like adults. So, but one difference that the teens are more likely to be younger children or adults to show impulsive and aggressive behavior. Again, if you look at the behavior at school, even at home, disruptive, disrespectful, destructive behaviors or aggressive behaviors, irritability, hyperactive, and they may feel guilty for not preventing injury or death. They may also have thoughts of revenge. So there's all these different symptoms which may happen during adolescent phase. The other effect of trauma in children, they have fear and a number of other symptoms: worry, sadness, anger, feeling alone and being lonely, alienated, feeling as if people are looking down on them. Again, that affects their self-esteem, they have low self-worth, not being able to trust others, again to do with attachment behavior there, and behaviors such as aggression, out-of-place sexual behavior, self-harm, and abuse of drugs and alcohol. In fact, research on, that's evidence there, that on child sexual abuse show that sexually abused children often have problems with PTSD. What are the treatment or therapies? Psychological, pharmacological. One, cognitive behavior therapy. Psychological therapy. We can also have exposure therapy. Another therapy called, EMDR, which is the eye movement desensitization and reprocessing therapy. It's quite controversial. And also you have pharmacology, which do with medication. Cognitive therapy. This is a very common, it's a very effective therapy. It's been used for all sorts of psychological problems. And so basically, it's a type of psychotherapy that's what we learn in books, in Eurocentric books, is that it was developed by an American psychiatrist called Aaron T. Beck. Now, this is why we need to go back sometimes to our own scholars, Islamic scholars. But if you look at the scholars, and thank you, Dr. Professor Sheikh Malik Badri, he translated a book on a person called Abu Zaid al-Baqi. In fact, he was the one in the 850, 900 century. He was the one who more or less introduced the concept of mental health and mental hygiene. In fact, it was al-Baqi who developed what is known nowadays as cognitive behavior therapy. There's a beautiful little book which was translated, has been translated by Dr. Malik Badri on sustaining of the soul, talking about different type of mental treatment, but also cognitive therapy. So when we look at books written in the West, we see Aaron Beck as the father of cognitive therapy, and that is misconstrued. This is not economical with the truth. So in fact, the person who developed cognitive therapy was Abu Zaid al-Baqi. He comes from Al-Baqi. It was in Iran before, now it's part of Afghanistan, if I'm correct. Okay, let's move on. Cognitive therapy. The next, exposure therapy, again, to make it simple, we use what we call systematic desensitization and flooding, where you get people to expose in the clinic first, in their own mind, going through situation, and then afterwards you go in vivo, you go in live, you do it, in real life, and then they go through those particular experience. So it's exposure therapy, it's desensitization therapy. It's called, sometimes we have two types, we have implosion and flooding. Again, these are a different technique used for systematic desensitization, and sometimes they call it exposure therapy. Next slide. Next slide, please. Yeah, move on. Let's move on again because I forgot to mention it. Next slide, please. All right, miss that as well. The next one. Next, all right. This is a controversial and conventional type of psychotherapy. In fact, although it's controversial because its acceptance is increasing day by day, especially for treating post-traumatic stress disorder, such as physical assault, automobile accident, or rape. It was developed by somebody called Francine Shapiro, psychology, in 1989. It doesn't use counseling or medication, but use an individual own rapid rhythmic movement of the eyes. This eye movement reduce the strain or stress of the memories of previous or traumatic events which has affected a person deeply. Let's look a bit more about this therapy. Next slide, please. So basically, the therapist moves his fingers back and forth in front of the patient's face, and will ask the patient to track or follow the finger movement with the eyes. While doing this, the therapist will instruct the patient to recall a distressing or traumatic event from the past, including the emotion which the patient feels with it. Slowly, the therapist will steer the patient to change this thought, this disturbing thought, to a more pleasant, more positive, agreeable one. So some therapists may also use substitute to finger movements such as toe or hand clapping or some sort of sound. The patient is asked to rate his level of distress before and after each session. So the goal of this particular type of therapy is to reduce the negative impact of the distressing memories on the patient. EMDR is used to treat many psychological problems, for example, panic attack, addiction, anxiety, eating disorders, depression, stage fear, and discomfort during taking your tooth out, dental procedures. But it still remains controversial, and we don't have so far evidence how effective it is. Apart from psychological treatment, you have pharmacology. You have all sorts of basically pharmacology or symptom management. We manage the symptoms until the person can get better. So we have all sorts of type of antidepressants and the tricyclic, basically antidepressant, and sometimes we use anticonvulsant as well, and these to treat that. But these are purely symptom management rather than treat the problem. The problem is there. This is a problem. Sometimes you go to psychiatrists, they give you lots of drugs, and you get addicted to the drugs, and you go on, you increase your tolerance, and you need more drugs all the time, and the problem is still there, because what you're doing, you're suppressing, or repressing at times those problems. So pharmacology is effective, it's very good, encouraged to do it, but it's only for symptom management. So sometimes you can use a combination of both psychological therapy and also a variety of conditions. In fact, in one of the cases, they use propranolol. Propranolol is a drug that it reduces your blood pressure already. So it has a physiological effect on your body. And so they're using antihypertensive drug to treat that as well. So there's a lot of research going on about treatment with medication. How do you treat in children? No different, but the cognitive therapy, psychological aid, crisis management, play therapy, very important, or special treatment maybe there for children who, for example, having out of context sexual behavior or extreme behavioral problem or problem with drug and alcohol. And play therapy can be very useful, in fact, to treat young children because they are not able to deal with the trauma more directly like adults do. So the therapists use games, drawings, and other methods to help children process their traumatic events. Right, beyond treatment, how can I make dua? That's the only way. Yeah, make dua and also seek treatment where there's a need to. And finally, how can I help myself? Next slide, please. Next slide. Thank you. Talk to your doctor about treatment option. Engage in mild physical activity or exercise to help reduce stress. Set realistic goals. Break big tasks into small ones, something that you can achieve, you can do. Trust to spend time socialize with other people or confide with trusted friends. Again, having the ummah, so having social support is very, very important. Tell others about things that trigger symptoms so that they can understand you. Expect your symptom to improve gradually, not immediately, and identify and seek out comforting situation, place, and people. In other words, make dua and ask Allah, oh my Lord, truly I'm in need of whatever good you bestow upon me. This is the end of my session. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm ready to take some questions.
Walaikum assalam rahmatullahi wa barakatuh, Sheikh. Jazakallah khair. That was definitely very helpful, and we hope our participants also found it beneficial. We will now take a few questions, so please type your question in the chat box. Please make sure that the question is brief and clear and related to the topic, so we can maximize the benefit from this Q&A session as well, inshallah. The first question, Sheikh, what are the chances of relapse once people come out of trauma? Can such people become normal like before or not?
Yeah, I would think that the rate of relapse would be high. People go back to it. It's like addiction as well. People go, so you go through several hoops before you get it there. Of course, when you go through certain things like that, which is so subjective, so painful, so hurt, it's like a scar with you, not physically but emotionally. Yeah. So okay, the only thing you have a improved quality of life. You're never going to go back to what you were before. Never. But with Allah's help and with your dua, you can have a better quality of life. Yeah. So there's a positiveness about it. We have to think positive anyway. But there's a relapse. You're going to relapse. Yeah. This is part of the whole process.
And continuing question from the same person, if people face trauma and get depressed, is this a sign of weakness in them, although they always feel strong connection to Allah?
No, these are tests for us. Yeah. We might strong imam. In fact, the people, the strongest imam, the people who are more tested, In fact, if you look at, the people who were more tested were the prophets. Yeah. So in a way, we all get tested. Then no, we can be close to Allah, but we still are tested. So no, we need to try to control it. We need to overcome these, and we have to supplication, dua. This is our weapon. This is the only way we can get out of situation. This is the only thing we can get out of, change our cadre, our predestination. So don't feel weak. Don't, sister or brother, please, tawakkul Allah. But at the same time, think positive. Yeah.
Yes. Okay, this is a question from Brother Usaid. He asked, can you please elaborate on the difference between PTSD and complex PTSD?
Complex, not to my knowledge. Can you say what's the difference? Sometimes you have complex disorders. The way I understand it is that you probably have PTSD with something else, some other problems. Yeah. Sometimes we have, for example, we could say we have a complex disorders where sometimes you have 2 or 3 disorders together. The way I understand it is complex disorders is that you have PTSD, you can have something else as well.
Okay, this is a question from Brother Warren. Can PTSD be caused by non-violent situations such as marital stress? How to handle flashbacks and dissociative events? These are 2 questions from him.
Okay, this is where yeah, of course, any trauma, if you have that type of personality, you take things, little things upset you, you're very sensitive, you have a marital problem. Of course, your separation, for example, loss, anything, this trauma, this is, we talk about emotion there, this is emotion, and this is going to affect you. Of course, you can have this anyway. But again, depending on the severity, intensity, what the trauma is, and depending on your previous personality. So it's a number of factors as well. And the second part was
how to handle flashback and dissociative.
Oh, right, yeah. Again, you have to go through therapy. You have to go through therapy because you're able to articulate those feelings, or somebody expert enough to be able to make you go through. You feel secure enough to be able to go through relive those experiences. Sometimes, again, you'll relive the experience anyway because this is the trauma. But having flashback, there's no medication to stop that. So the only way you can do it is talk therapy. Or not only talk therapy, but also cognitive therapy.
Okay, sis, there's a question. Are there any specific duas to help PTSD?
I think you should ask Sheikh Sahib about this. No, I don't know any dua, but I think, there's a lot of dua you could ask for your health. Anyway. No, I don't know. Sorry.
All right, and Sister Yasmina, she says, Jazakallah Sheikh, but how do we treat the trauma when the person is still going through it, like in a war zone?
We can't. This is the problem. In fact, that's what our brothers and sisters are going through at the moment. This is the pain they're going through. We must feel it sometimes, and try to empathize and see, what they're going through, bombardment and dying and all sorts of things. So yeah, you can't. There's no way. But how can you treat it? Okay, there's no services, health services or structured. If afterwards, when people go to camp, then they get some sort of treatment anyway. But during the time, there's nothing, because you're in the situation, and if there's somebody there, but nevertheless, because there may be other things coming up, maybe become complex because it's like having layers and layers of trauma all the time, cumulative trauma, what I'm saying anyway, and this is tough. This is very tough.
Okay, Sheikh, this is a question from Sister Iram. She says, Assalamu alaikum. I failed in my exams and now people always remind me of my past. How to get out of it?
Wa alaikum salam wa rahmatullahi wa barakatuh. You have to believe in yourself. You have to believe in yourself. and you make the effort, Allah will find you the way. Yeah. People might say whatever it is, but if you're doing something halal, something right, believe in yourself. Because if you don't, nobody else is going to. But also, you need to trust in Allah. That's all I can offer you advice.
Okay, and there's a question from Sister Oinda Mola. She asks, how can you identify PTSD in under 5-year-olds?
Again, we say that the symptoms is very different for children, and because they don't show the same symptoms, and so you have to know. I think I said yesterday
Even
that
younger than 5-year-olds?
Pardon?
Sheikh, when we were discussing about PTSD in children, you spoke about children between 5 to 12 years. So the question is specifically under 5 years.
But what if they never use, if never what we call enuresis, they never went to bed before, you know, and sometimes they have difficulty in speaking, you know, because that affects the speech sometimes, you know. And probably have a nightmare, and very attached, emotionally attached to the parent. They fear the separation between parents, like what we call separation anxiety as well. So there are different symptoms, but they sometimes, like I said, they might show it in their play, in what they say, and so forth. And every parent knows their child better than any psychiatrist, psychologist, or any teacher. And you know the child how he was before, and if they might have gone to trauma. For example, it could be a marital problem, it could be aggression at the home, it could be domestic violence. This is trauma for the children. They too can have post-traumatic stress as a result of this, of domestic violence as well, because this is part of trauma.
Okay, Brother Warren asks, how to help family member with PTSD?
Seek treatment. The whole family, maybe sometimes, like I say, sometimes you have to have family therapy, yeah, and you have to treat the family. Drug is not, like I said, drug is only symptom management. You ease the symptoms, but in the end, Islamic counseling, Islamic psychotherapy, counseling with Islamic counselor who understand your deen, who understand, have the same aqidah as you, and also, so yeah, you need to seek treatment, and also never give up making dua.
There's a question from Brother Abdul Ghaffar. He asks, is there any timeline for PTSD?
No, we talk about the beginning that it could happen after 6 months, and and it could also happen sometimes after years. Could be 2 years, 3 years. And suddenly, you had a car accident, and and you have repressed it, and suddenly something trigger, or you go through the same experience and trigger. So there's no age in a way. And these things can happen anytime, but more or less we talk about 2 years, or more, sometimes 6 months, after 6 months or 3 months.
Brother Rashid, he asked, what is the boundary to know, or how can we come to know whether this problem, it requires treatment from du'as, or should there's something more serious like medication needed?
It depends on the severity of symptoms. We talk about the 3 main symptoms, which we mentioned it again. It is, excuse me, you really re-experience the events all the time, which means every time you have nightmare about it, or you have bad dreams about it, or there's avoidance or emotional numbing, which I said before, and there's probably a lot of disturbed pattern. You start developing anxiety, you start depression, and so forth. Again, it's very difficult to just say that, but I think you have to see the patient, and then you assess them, and then depending how these categories, these symptoms is affecting their life, then you can decide whether they need medication or not, or just pure counseling or psychotherapy.
Sister Nazia asks, Assalamu alaikum, what are some of the daily coping skills you could use and other than relaxation and breathing techniques?
I mean, you do that with stress. Yeah, yeah. And so with stress, you do breathing exercise. Pray nawafil, pray salat. It's not quantity, it's quality. Yeah, and these are forms of meditation. Yeah, and when you pray, you're away from things in life. You're focusing on your Lord. Your blood pressure go down, and you're moving all your muscles. It's a form of relaxation as well. So just follow the sunnah.
All right. And Brother Taiwo, he asks, is psychological counseling better than pharmacological therapies? I think he's talking about medication.
No, I won't say they're better, but I would say that pharmacological treatment, there's a place for it, but also we can abuse it, yeah, because you can end up with same tablets all the time, sleeping tablets, whatever it is. There's a time what I tend to recommend people, if I think that they have the severity of illness is so severe that they need pharmacological treatment, but on a short term, monitoring it. We need to monitor because you take certain drugs, medication, they have a lot of side effects. Yeah, sometimes you're not tolerant to certain drugs, sometimes you react to certain drugs, sometimes some drug is dosage too much. So we can't say one is better than the other. Of course, there's a place for everything. You have the pharmacology for symptom management, but also on a long-term basis, you need to have counseling or psychology.
Right.
Or cognitive therapy.
Okay. There's a question from Sister Tazeen. She asks, is there a cure or some strategy for one who has suffered stress in the past and then now they want to overcome eating and sleeping disorders?
Can you repeat it again? Sorry. Can you repeat it, please?
Is asking, is there a cure or some strategy for one who has suffered stress in the past and now wants to overcome eating and sleeping disorders?
Now, I don't know the sister or the brother. No, in fact, the way I interpret it is that if you've gone through it and I've come out of it, I see it as a strength. Which means you look at, if somebody said, I've gone through a bad experience, I've come out of it with a bit of support here and there. So you have that strength. So if you can do it, you have done it once, you can do it again. So use the strategy that worked for you. Nobody can tell you, do this, do that, do that. Each person knows. That's why, in Islam, we have to have self-awareness. We should know about ourselves, yeah? Our psychological being, our spiritual being. And, and so once we know about ourselves, then we can help ourselves. We have to help ourselves first before Allah is going to help us anyway. So I think, sister, brother, you have already had that strength. You need to look at that strength. Identify that strength and use it. Be optimistic. Be pragmatic in the sense that if something works, why not? It is halal.
All right. Sister Alma, she asks, is PTSD similar to depression?
No, but you have depression with it. Yeah, it's different because it's diagnosed differently. You see what I mean? Because the DSM-5, the Diagnostic Statistical Manual, they have separate thing for diagnosis for depression or PTSD. But in PTSD, people get depressed, people get suicidal. So a lot of depression. Yeah? PTSD is an anxiety disorder. You get anxiety, you get panic attacks. So maybe this is what the other speaker was, brother or sister was asking before, that sometimes they become complex, yeah, because you have a number of disorders associated with PTSD.
Right.
But it's not depression, it's associated with depression.
Right. This is a question from Brother Taiwo. He asks, who should the person with PTSD symptoms see for treatment?
Who?
Yes.
They need to have, it depends on the severity of it. If it's affecting their life, their family, they can't do anything, they sleep disturbance. Of course, they have to seek treatment. First of all, probably go to a psychiatrist, but there's no reason why. In fact, like I said yesterday, some people would say, do ruqya as well. There's no reason, because for psychiatric treatment, psychological treatment, you can do both. But in this case, you see a psychiatrist, but also having psychotherapy and ruqya. There's no reason why you couldn't anyway. That's my opinion.
There's a question from Sister Abana. She says, I tried therapy, but it doesn't seem to be working. Someone mentioned to try hypnosis. Is this halal? And if so, can it be done?
As far as I know, hypnosis is haram. Full stop. Because I was looking at different complementary therapies, and I wrote a paper on it. And I found that a lot of my friends, even family, were doing yoga, and they tell me, no, I'm just doing the exercise. I'm not doing the mantra. It's not. And in fact, I'm sure it has Sheikh Uthaymeen, one of the Sheikh mentioned about it, that, hypnosis is haram. Yoga is haram. And many of the complementary therapies, are haram. So be careful.
All right, Sheikh. The next question is from Brother Warren. He says, how to make sure exposure therapy doesn't cause a worse reaction? Can a family member help with exposure therapy?
Yeah, because sometimes it goes into life experience. For example, I'll give an example. Sometimes people have snake phobia, just fear of snake. They might do a technique called flooding or implosion, where they throw a snake basically at the person. I mean, I know you have to do that when you know the clients very well. But this is when you make people react. The reaction is the anxiety is so high that it tends to stop completely. So yes, sometimes but sometimes you have to relieve the bad experiences, okay, and to make it better. You see what I mean? So yes, it might bring, of course, when in normal therapy, people come for something else, and then they come out and they find out they have something else. They have problem with family or spouse or partner or whatever, and then they're already some experience which happened, and then they start thinking, oh my God, I was sexually abused. All these things can come out because all the things people denied before. So sometimes when you do therapy, other things can come out as well. So in that case, of course, it can make things worse before making it better.
We have a question from Sister Sarah. She says, Assalamu alaikum. My father has cancer, and I always feel afraid to lose one of my parents, and I can't sleep. How can I get out of the idea of losing a member of my family?
Loss, any loss is going to be painful. But as Muslims, we have to be prepared for that. In fact, we have to think of death every day. This is it. It's, I had a client like that, and in this case, her mother died of cancer, and she was afraid that she had built that fear, that phobia, that she's going to die of cancer. It took a while. We worked on cognitive therapy and a few therapy, and inshallah, I think she never came back to me. So inshallah, I hope she's okay. But again, it's part of our daily thinking and living. To have to experience those losses anyway. I mean, there's no pharmacology, no drug treatment is going to do anything for you anyway. But I think, again, go back to the Quran, go back to the Sunnah, make dua. That's the only thing you can do.
Sister Iram asks, my father is a patient of depression. He gets angry easily and also has eating disorders. How should we as family members help him?
I think, depending on his age, you have to try and understand him. Maybe is it older, and I'm sure in that case probably he is. If he is, let's assume he is, then you have to understand his symptoms, and maybe there may be some underlying causes there why he's aggressive. Is it because his needs are not met? Or because he probably demanding too much? Or is because, we have to find out. We have to find out what his basic needs are. Because sometimes people are frustrated or get irritable or get all sorts of behavioral problems because, a particular needs are not being met. Probably, I don't know, he may need, maybe it's a form of attention seeking. Maybe he need attention. Maybe need people talk to him. I don't know, Again, it's very difficult online to just say all these, advice, but you have to see the patient point of view, and then you can make some form of judgment and make some sort of assessment. But what I often say is find out what his needs are. Try to understand him better. Have patience. That's all you can do. We have to respect our elders, no matter what they are. So I don't know whether he's having treatment. Maybe he needs some medication, and see what happened. But why he's depressed? He has he always been depressed before? What type of person he has? And is it because he doesn't have any function in life anymore? Has he stopped working? Is he retired? We have to find out all these, because all these data will make us understand him better and provide care, appropriate care to our father, mother, or whatever it is. Okay.
This is a question from Sister Lamia. She says, we got hurt from people to the point that we lost our job. Now we are afraid to upset anyone and still go through a lot. What can we do to empower ourselves and gain our self-esteem around people again, please?
Yeah, it's difficult because once you lost trust in somebody, that's it. There's no relationship. Trust is very important. And because we had that bad experience, doesn't mean that it's always going to be that. So in a way, we have to try to believe that there's some good in people as well. Yeah, not all everybody's bad. But at the same time, we got sort of from a humanist point of view that everybody is good, because there's evil in people, there's good in people as well. So how do we return? At one point in time, we have to start trusting, because if you don't trust, but then we have to be we learn from this is it's about learning from experience. It doesn't mean that you repeat the same mistake as you did before. Learning from experience means that what you've gone through before, look at it, and not to repeat the same mistake you made before. But again, it's not easy to try to trust people once you've gone through this trauma.
Right. This is a question from Brother Senate. He says, Assalamu alaikum wa rahmatullah. Is it permissible to seek treatment with a non-Muslim psychologist?
Wa alaikum salam wa rahmatullahi wa barakatuh. Yes, of course. But if there's nobody else, what else can you do? I mean, if you're Muslim, I would encourage you to seek somebody who practices the deen and who does psychology. But if there's no choice, then you have no choice. You have to go to somebody else.
And he further asks, and can I study Western psychology? Because this inspired me so much to study it here in the West, but there is no Muslim therapy place or school.
There's no
place which is specifically for Muslim or combining with Islamic theories. It's only a Western psychology.
No, I would think, I don't know, a lot of the Malaysian university does Islamic psychology anyway, and some of the courses you can do online. And again, Islamic Online University, that's what we are trying to do. All our courses, we try to develop from an Islamic perspective. I mean, I just, for example, it goes on stress and coping, which is coming out, inshallah, next semester. Again, it's based on the Quran and Sunnah. So a lot of our courses are Islamic psychology, because, okay, we look at evidence from the West, but also we go back to the Quran and Sunnah. So you don't have to, you can study Islamic psychology from IU or a lot of universities does that. Of course, you can. Western psychology is good, but then depend what you want to do. Depend where you live and what you want to do. But if
That's
you have a
all.
chance, if you have a chance, you do both. You know, you do Islamic psychology. Unless you're looking for a job as a clinical psychologist in a European country, then of course you have no choice. You know, you have to do a degree in psychology from a Western university, and then do a postgraduate course in clinical psychology or educational psychology, occupational psychology, depending on the branch, or even health psychology. Then but if you're not, if you're just seeking knowledge, yeah, and why not Islamic Online, BSc Psychology, or certificate or diploma.
That's all the time we have for our Q&A session with Dr. Rassool. Well, once again, we thank Dr. Rassool for joining us today, and we look forward to hearing you again tomorrow when you will be joining us to speak on addictive behaviors, inshallah.
Inshallah.
We
Okay,
will now
salam.
go. Wa alaikum assalam wa rahmatullahi wa barakatuh, Sheikh.